Hello and welcome to Beyond the Arches. I'm your host, Dr. Daniel Northuck, and with us today we have Dr. Blake Hauer. Hello, Dr. Blake Hauer.
Hello, hello.
How are you doing today?
Pretty good. We had a good eventful morning of surgery and patient care, and now we're hanging out and enjoying beautiful sunny South Florida in November.
It is a beautiful day out today. So today we're going to be talking about the done-in-one patient experience and sort of like the ins and outs and more like the personal boutique sort of style. So we're going to go through, sort of step-by-step what happens, the moments, the human side of it, like what happens through the process, how do we make it sort of a personal experience? And so in talking about that, I just did a consult before we came here, and they had gone, some patients come through and they're very in tune with the process, and some are not. This gentleman happened to be pretty in tune with it and had gone to several consultations. So in talking to him, it's always fascinating to talk to somebody that has that experience, because they're going to have more of like a gut check feel on how another office works, and how does that connect with that patient. And you can kind of get that feeling when you're talking to them in the consultation. And so one thing that I've really pushed on and been excited about with making done-in-one and seeing it grow is being able to kind of add that human personal side and that sort of friendship. You know what I'm saying? Like,
yeah.
We try to add that human element because it's important, just as important as it is for us to talk about clinical stuff like we did on the way over here. It's also important to, as a business, to understand that there's another human connected to those decisions.
Yeah, I think at the end of the day, there's so many players in the industry, but patients are attracted to different locations, mostly because they're comfortable with the team, and we have a normal human component. I mean, people want to feel like they're obviously getting a good procedure and service done, and you're going to have the right experience. But, things that we do solidify that for the patient. I feel like the travel package, we probably take an hour block for a virtual consult. We offer those consults. We're not pushing treatment right away. We can have multiple consults, so it really puts the patients in a good position.
Yeah, and that connection really is formed on day one, that consult. Really, it should be formed in the phone call as well. And if anyone ever asks me, a colleague ever asks for advice on their full arch practice, as we're talking through things, generally they'll have the mainstream will kind of have led them a little bit astray in that they are led to believe that they should just be doing surgery or doing patient busy work of sorts, and that's the sign of them being busy, where they let most of their staff do the consultations. And that's tough, because how do you know the ins and outs, and how do you make that connection? If something goes wrong, how are you going to connect with that patient to make it a better experience?
Yeah, I think, my perspective is so different because I'm obviously new by, a couple months here. But from my view, I think the number one thing for patients, which they realize, is at first they ask questions.
I think we're at 1 month, by the way.
I think it's about 2, actually.
Oh, yeah, it's a month and a half.
Patients come in and they start to ask, okay, what are the number of implants? What are the materials we're using? Things like that. But then we quickly let them understand that not only are we going to satisfy them with that, but this is a home that they can come back to. They can be managed. They can be cared for, and we can manage any issues, positive or negative, with them. So this isn't a situation where you're going to go and you're going to travel somewhere very far and not have someone on your team. So I think that's something that we do that others don't do, is that we're not a prescriptive surgical center and then you're done. We offer many things to carry the patient through, because anyone that has mileage in implants knows that implants are fantastic, but just like a hip or a knee, the body has biology and things can happen.
It's not just the done-in-one surgery approach. It's sort of a lifetime experience. And that can be hard to explain to patients, that there's a reality where they kind of need to be our friends for life. They need to be in connection with us. Unfortunately, sometimes, they're not, well, I'm not that friendly of a person, and I don't really care about that connection. Well, you should, because it's going to be a lifetime that we're a little bit attached at the hip.
Yeah, and we definitely enjoy it. I mean, just from my couple months in, you never know who you're going to meet. I think one time I came in the office, and then, or actually almost every day I'm in the office, I think there's gifts from patients. Today there was a lunch. The other day there was, I don't know, a bottle of wine. I think so far I've heard about a Rolex being given out. I received a bottle of whiskey. So, patients are happy. Gifts are being given, and it's about a relationship, for everyone to just be on the same team.
And we've covered it before, but let's start off a little bit today with going like step by step,
Sure.
from the consultation to the delivery. To us, it's a little bit of a broken record because we do these consults where we explain all of that every day. But to a person that's just joining us or hasn't heard it before, we'll kind of walk everything through. So for us in particular, you're going to have a consultation. Consultation generally is going to be review of an x-ray, discussion of whether or not it's appropriate, where you've been before, what your experience was like. A lot of reassuring happens in the consultation. A lot of discussion of past experiences. That's something that we deal with quite a bit as a profession, but more so too, there comes a role where we're discussing a lot of prior issues and discussing sort of how cases go and the good and the bad and the ugly, and really kind of forming that initial connection.
Yeah, and we're getting to know the patient. Some patients are more driven for function. Some are driven for aesthetics, both. We want to, strive for both, but everyone has different interests, and, you understand what someone's looking for. And many times patients bring in an old photo. I think that's one of the best ways for us to know, where we're heading.
Yeah, it's funny because they're actually, now that we have an office in Tampa, Jacksonville, and Boca, where Boca can vary widely in terms of the geographic location. It's pretty wild now that as I do the consults for the different offices, how just geographically patients' demographics and motivations change. Like the consultation is almost inherently different in Jacksonville than it is to an XYZ Boca case, which is kind of fascinating. Very geographic location dependent. But from the consultation, generally they'll go with a treatment coordinator, and that treatment coordinator will be in charge of their scheduling, figuring out their financing with them, and working out prescriptions. The prescriptions go back and forth between you, myself, general dentist, and the treatment coordinator, maybe a medical professional, where we figure out what's going to be their best, cocktail in taking care of them.
Any patient that is taking medications that may interfere with the surgery will communicate with your physician, or will make our best judgment call, such as patients that are on blood thinners. So this consult as well has a medical history component, so that way when you're ready for surgery that day, we check the boxes off to make sure you have the right medications being used or are held for some period of time.
Yep. And then to bringing it into surgical day, we have the surgical day, which includes additional radiographs, taking pictures, initial pictures, just to get an establishment of where they began. And then that's where you and I's job mostly comes in. And that job is to obviously do the work, remove teeth, remove bad gum tissue, kind of set the case up for future success, identify anything that's, wild or different than normal, and then place the implants and get the records of, we always say like exactly where the implants are, where the gum tissue is, and where we think the teeth need to go. Once that's done, it's sort of what you and I do then after the surgery, which I've always enjoyed, is that we go talk to the escort. And the reason why that's important, I believe, is it really helps cut down on post-operative phone calls. We used to get a lot more post-operative phone calls before I did that. And I think that giving instructions to the escort is important, because it allows them to have a peace of mind and a contact of where they need to go for, if they have any issues or anything.
Yeah, there's nothing wrong with just re-solidifying, the facts of what we want to share with the patient. Something we commonly share is, make sure you finish your antibiotic. Even if your pain is low at day 1 or day 2, we want you to be on your pain medications for at least, I say, 3 to 5 days usually. But one thing to rewind about the process is that in most cases that are straightforward, once you get in the surgical room, we're going to have you sedated, whether you're on laughing gas, whether you're on an oral medication, or a combination of both. And then the surgery, whether we're doing one or both arches, is anywhere really from an hour to maybe 2 hours-ish. It doesn't take that long. Obviously, there's cases that can be longer or shorter, but this is not a long process. So that'll kind of get us into, getting into the next day and the teeth component. But once the surgery is done, your subsequent visits for working on your teeth are really no more than 20 or 30 minutes.
Sure. Yeah. It depends on how much the patient wants to get involved with their design. And that really is where the human element comes into play. So when the patient goes home that evening, what we're going to do is we're going to take the digital information that we have, and we're going to combine that into a record of what we always say, like a rough draft of where we think everything needs to be. And that rough draft gets printed, 3D printed, and then we insert it the next day. And we can do that as many times as we need. And that's where it's what we've brought in terms of protocol has been really, really fun, because it allows that patient to be as deep in it or as peripheral as possible. It really tailors to however amount of involvement they want to be.
Yeah, I think that's the beauty of having your full arch All-on-X, however you call it, surgery at a facility that owns their own lab, because during that process of having your prototype, which is the next day teeth, we're not just doing one prototype and saying ready to go. Are there situations where maybe the first prototype is great? Of course, but you have the flexibility to go to 1, 2, 3, 4 prototypes during the first couple days to really get those functions of those, teeth size, teeth shape, color, bite, everything, the way you want it. So we're not pushing you to just choose something. So I think that really helps our patients. So that way, when we go from the prototype to final zirconia material, there's not this big change.
And so we'll take a little pause there, and I just like your feedback. So when it comes to explaining that to patients, it's very hard because you're kind of fighting a balance between appearing like you're just shooting in the dark and the person that says they're going to do it the first try and they're exacting, right? So the first iterations that we did 10 years ago was very similar to Nuvia, and we did cases and delivered 24-hour finals. Well, it's not that it can't be done. There's plenty of technology to get us lined up with everything. The problem is that you kind of cut out that human element that we keep talking about. And so that's why we've protracted and extended the timeline, is to get that sort of personal feel and to get everybody's opinion weighed in. But it's really hard to explain that in a consult to a person that you don't really know, because you can seem like, well, these guys do it in 5 sets and these guys do the same thing in 1. And I know what the dark side is on the other end of it with having cases that don't go the way that they want them to. But in your opinion, how do you think that we can better convey that message? Or, how do you think how do you explain that to a patient in a better way?
You're trying, just to kind of read out your question, how do you explain, why our process works and the whole idea of multiple rounds of temps and then not going to a final like the next day?
Without sounding like it's inferior to the process that claims that they do it right away.
I would say my answer is that everything works till it doesn't. And when you're in the digital world, it's excellent and you can have all the scans and everything down to the micron. But sometimes something that looks right on the computer just doesn't look right on the face. And sometimes you need 1, 2, 3 different test runs for that. And that's why our protocol is beneficial. And sometimes you look great, but the phonetics are off, the speech is off. So there's nothing wrong with giving patients those extra opportunities. And I think that's the contraindication for doing the zirconia at 24 hours, because you're still basically having post-surgical trauma, swelling, and you're not numb the next day, but you're just wearing off, maybe 12 to 16 hours before. You may not make the most educated guess. And I think in addition, as a longer part of my answer, having a next day zirconia changes the way the surgery is done, and it's just a way different process, and it probably requires more visits as well pre-surgically. So I guess that's my long answer.
Yeah, it's tough. It's a hard thing to sort of explain that you're not doing. The reason why you do several versions isn't to find your way; it's to help guide the patient along their path. It's to help explore what is available and get them into a set of teeth that genuinely is custom to them.
Yeah, it doesn't mean other protocols don't work. I mean, there are protocols where you have one prototype and then you wear it for 3 months and then you go into a final. There's protocols that we say, okay, the next day you get a zirconia, then that's it. There's different ways to maximize a final result, but we believe that, having multiple rounds of a prototype gets you the aesthetics and function you want, and then having a zirconia highly polished restoration within 7 days gives you the best soft tissue healing, and it's stable for your implants. And having our own lab allows us to do that. You can't go to an office that does 2 arches a year and have our zirconia delivered in a week. It's not going to happen.
Yeah, and maybe the way to sort of use some sort of example would be that it can be very not have it your way, maybe a little bit more like fast food when you're in the 24-hour process, because while you can still make a few tweaks and changes at the same time, it's very much inherently the same meal, if you will, versus like Chipotle where you can really customize it. And Chipotle is still a little bit of an assembly line. I actually really like this example, because Chipotle or anything that's a little bit more of like a nicer fine food, you're still getting a very repetitious, repetitive type process that's very predictable. The quality of your food in Chipotle is very repetitive and predictable, but there's a lot of variability that you can make inside of that in a shortened time frame to if you wanted to make it yourself. And the old way is like making it yourself. Still comes out fine, but may not have that, restaurant pizzazz, and may not be as easily interchangeable, if you will.
So you're saying you align more with like the Chipotles and Fresh Kitchens of the world and Bole's, not like the Arby's and
correct,
McDonald's.
Yeah.
Okay.
I would say so. They can still do customization. That's the tough part, is you say have it your way, is that, the Burger King line, right? But it's have it your way, like how many different ways,
Yeah, I think, what we're trying to say is that you have to have some element of consistency, but also some element of customization at a high quality level.
Yeah, and I think patients would be shocked to know, speaking of consistency, I think patients would be shocked to know and see how repetitive in nature the fundamentals and the basics of doing this procedure is. Because it's very easy to make it seem and overcomplicate it. The way that you might have been, the way that you were trained in the full arches that we've reviewed before you kind of walked into the system, was a lot more highly variable. Whereas this is a very repetitive surgery, but that's not to the patient's detriment. It's to the patient's, to the positive for the patient.
I mean, not every surgery is going to look the same, but I think if you have a consistent surgical workflow, you're going to have more consistent surgical results. And that's important. It's not a free for all. Just figure it out when the patient comes in, but we like to have a similar, display of implants for every case, and that leads to a more similar, screw access holes for teeth, spread of implants, and we control sort of more of the prosthetic factors, which is important when we place implants in a similar way.
And part of it is too, we've tried to build something that's personal and not just transactional. You know, the part where you see them, you do the teeth, and you move on, you know, it's sort of transactional. We've tried to make it so that it's personal. And the way that we do that is by having those contact points and by having that interaction with the patient so that they understand that they're heard and that everything is meant for them by them. Then, so once we figure out the design in terms of the process, once we figure out the design, that design file then goes into the zirconia milling machine, and the zirconia milling machine produces a raw state of the zirconia, and then it goes through several finishing steps where it goes through essentially what amounts to an oven, and the gum tissue is added. And one thing that's cool in that consistency, or talking about that consistency, is that when you look at the file, or the file is the same, but if you look at the 3D prints of the prototypes and you compare that to the zirconia, it's a very accurate representation for the patient. And so when we go into that final delivery, there really isn't any tension on the behalf of the patient because they know that they've seen other results from other patients, but also there isn't any tension or angst from the side of the clinician and the staff because we know that it's going to fit right and it's going to feel right to the patient. Which that all helps add to that personal experience. When you have a situation that's sort of high tension, you know, I've gone into plenty of deliveries where we were concerned about the results that we were going to have just because of the handcuffing of the old way.
Yeah, and one thing to add is, you know, once those teeth, you know, come in the office for delivery, you're having the input of a periodontist in Boca, a restorative dentist, a lab technician, a dental designer, and probably, I guess, lab manager. You have everyone coming together to make this product. So we're not just, you know, sending this off to be printed. I mean, you're having a lot of care and attention that are going into this case, which is really nice.
Yeah, the efficiency is what brings that ability to have that extra care and attention, that extra customization. Because the general dentist speaks the same language as the designer, and the designer speaks the same language as the lab manager. I'm not talking about actual language, I'm saying in terms of instructions. Because they're all on the same page, they all know how to do their job and therefore are more efficient at it and can spend more time being excellent at it.
Yeah, it's key. And when we're all on the same page and we're all under the same roof, if you ever have an issue like, oh, you chipped a tooth or you need something fixed, it's going to get done very fast because we can get any problem fixed, you know, in a good schedule because everyone working together.
I used to know the lab. Well, I know all of my employees pretty well, actually. But from a standpoint of, let's just take the Tampa doctor and how he knows the lab manager, it's definitely a lot more distant than it used to be. Mm-hmm. When I worked in Jacksonville, before I started Dun & One, I used to really intimately know everyone at the lab because I used to have to go there to make sure that everything was appropriately communicated. And that's just not efficient, and it doesn't lead to the best results. It's not as personal. It's less of a studio and a little bit more of a inefficient factory, if you will.
Yeah, it wasn't around for all that sweat equity, but I can imagine before photogrammetry, intraoral scanning and everything, life was a lot harder.
It was just very different. It was a lot more reliant on the art, and the specific person you had do the case was a lot more. The quality of the work and the quality of the result was a lot more dependent on the person than it was the actual result was way more practitioner dependent. Now I would tell you that it's more dependent on the beliefs and the tools as well as that personal. The team is still important. The team is what pulls it off. The team and the way to communicate with the patient is very important. But equally important is the way that you get the information and the way that you customize and the way that you treat every patient. And I always tell patients in a consult that the number one thing for us is to make sure that your big take home is the way that we used to do these really put a lot of blockades and tension in between our relationship. And it's not like we have to be your friend, but I also definitely don't want to be your enemy. And so with all that tension in the way, that got in the way of getting good results. And now that we've tried to eliminate that, that was the whole intention of this protocol. It wasn't to make it so that we only see a patient for an hour. It wasn't to only see them for 24 hours. It was to get better results, believe in the product that we're selling, and gain that sort of relationship and that friendship and that trust over time.
Yeah, I think that kind of segues us into, what are we doing differently? And maybe we can hit some of the key points that make, done in one better for the patients as far as the product and the experience. So what do you think are like some of those key points that make us unique and, help with good results?
Well, for the number one thing, I think, is a reduction in the interaction time between a dentist's office and the patient, because we know that full arch patients don't generally have a good experience or track record with a dentist.
They don't want to spend 6 to 8 hours in the dental office at once?
They don't, generally. Only weirdos like to spend 6 to 8 hours in a dental office. And so reducing that time makes it so that their interaction is pleasant. It's not about seeing them as little as possible. It's about seeing them as little as possible so that we don't inflame the trauma response, if you will. We're not trying to, put anybody in a dark place. So that's number one. Number one is reducing that time to increase personal interactions and their overall thoughts towards the process is positive, while still giving them the keys to the castle, as it were, keys to the car, for being able to fully customize it. I would say that that's the number one definer. Don't you think?
Yeah, I think it really stands out to me. And I think other things that come to mind are probably our hygiene program. A lot of people do full arch, utilize a lab to deliver a quality restoration, but then the patient's sort of just up in the air and there's no plan on how often we're going to remove the teeth. Are we going to clean the teeth? There's no person in the office that's educated or has the time to instruct the patient how to do proper hygiene. So I think that's a big positive, is that these patients that we treat aren't left to just figure it out.
I agree. It's a huge benefit, and it's one that is a major issue in the industry. We see it every week, where we have essentially not patients that were abandoned in a negative way, but they were abandoned in lack of education and lack of understanding how they're supposed to take care of it. I visited a friend in California this last weekend, and he's done several hybrids. And when I was asking about his cleaning protocol, this isn't against him, but it was just very up in the air. I clean them sometimes in association with their bottom natural teeth. And if you talk to a general dentist as a regular, as a habit, you would find, I think, that there's a lot of them that don't really have established protocols, because it's very difficult to find that sort of standardization across all of the industry.
I think the problem is there's one group of dentists who are afraid to remove the teeth because they don't want to uncover problems they can't fix. And on the other end, you want to remove the teeth because the reality is the underside, we call it the intaglio of a full arch, it's just hard to clean in any hands. So about once a year, it's nice to have a boost to sort of just have it clean outside the mouth. But I think with the best of both worlds, it's appropriate to diagnose properly the implants. You can't see everything off an x-ray. You also can access, all the prosthetic equipment and make sure it's functional. And you can then assess the soft tissues. I know we had an episode and we talked about why we do what we do as far as hygiene, but pretty much summarizes it.
It's a definer.
Yeah, we want to just see what's going on, and we don't want to leave our patients to just figure it out. And if we can catch a problem before it becomes a real problem or a big problem, then we can actually help our patients not have, loss of implants or anything else, which then sort of ties us into number 3, which I think is we do offer a warranty, which is kind of unheard of in the industry. Are other people doing that, Dan? Do you know?
Yeah, the general thing on the industry is that they will claim a big warranty, and then there's like very like verbose claims on what they offer. But when you read the fine print, they're gonna nitty gritty you down to death in terms of eliminating that warranty. Like, can't ever be seen by anybody else. Has to come in every 3 months, which is bad for the implants, but has to come in every 3 months. Something that's completely out of the bounds of reality. And so they sort of fine print them to death. Does ours have fine print and legalese in it? Yeah, of course. That's just the reality of the world. But we tried to create a program that was very open to the being in the patient's benefit, no doubt.
Yeah, I think the bottom line is that if our patients take care of their teeth and implants like we recommend, then we'll take care of them if they have an unforeseen problem.
Yeah, it's trying to reward the population that already did something for themselves and is going to continue to do something for themselves. There's going to be a subset of that population that always shoots themselves in the foot. And that's why there is fine print, because we can't just let a patient completely go without any responsibility or trying to do good.
Something I think we forgot to say is we were talking about the timeline, and we kind of stopped the timeline at getting the final teeth in a week, and then we jumped all the way to once a year cleaning. In between, we're going to have a 90-day assessment where we make sure that everything is healthy and functional. And from getting the zirconia teeth a week to the 90-day assessment, our patients are going to be on a soft diet, meaning that anything you eat is probably going to be able to be mashed on your palate or cut with a plastic fork or knife. So that's another key milestone in the treatment sequence, which then leads us to the once-a-year maintenance. Does that pretty much sound right?
Yeah, absolutely.
Okay.
And so in terms of things that we do different, obviously what we said was there's a big personal experience aspect with the time involved in giving them a good experience with the dentist, not inflaming trauma. There's the warranty. We didn't mention sort of the fact that we are a 7-day process, so it is quicker than traditional norms. The reason why we believe in that is, the healing becomes or is a lot better when it's a well-made, perfectly lab fabricated prosthesis, resistant to bacteria collecting for its healing, and helping splint and help with those implants as they're healing. All of those factors go into why we do it for 7 days. But I would say, 7 days is sort of an aspect of our experience that's unique. And then, of course, the major obvious one for Boca is the travel package. We see 80, 90%, something like that from out of state. And those patients, what ended up being sort of a happenstance, from 7 years ago, has now led to be sort of our main breadwinner of sorts. And in my opinion, not only is it unique to the industry, it's something that's like really pretty fun and pretty special. Patients can come into town with a peace of mind that they're going to get picked up, that they know where to go, that they aren't going to have to worry about extra things on top of the results of their surgery. But from our side, we know that they're going to show up. We know that where they're going to be for their healing. So it kind of is a two-way street, and it's really pretty fun to see people from all over the states.
Yeah. I don't know if you had Daniel on the podcast, but he's a key employee that works at the company, and basically he's going to run, a lot of the travel package. So meaning that if you're someone that comes out of state, you'll have someone that's going to pick you up from the airport, bring you to the hotel, bring you to your appointments, and you make sure you're taken care of even if you have family with you. So that's a huge plus as we have that. I think someone actually in a consult this week said that one of their problems is they need someone to watch their puppy. Maybe he'll even watch your puppy. I don't know. We could work that in.
He does quite a bit. I mean, in the old days, we did a lot of different things. I can remember one specifically, my brother was helping with moving patients around. He happened to be in town, And so he was helping with transporting patients. And the guy had brought an Xbox, but the hotel did not allow for external HDMI cords, AV cords to get plugged in. And so my brother went to the lab, grabbed an extra monitor that we had, and brought it back to the patient so that he could play his Xbox while he was healing. Those are the little one-offs. There's been a lot of different scenarios like that. I know that Daniel has brought a decent amount of gauze to different patients and is generally there to really kind of help them out. He's always been one to pretty much go above and beyond for the patient experience. So we haven't had him on the podcast yet, mostly because he's been shying away from it. But we'll nail him out.
I think what I'm trying to add here is that, having another person involved in the whole process, sort of after hours and in between appointments is key because, not every travel package is, the same. And if there's something that you need while you're here, we probably can make it happen.
Yeah. And that all came from when I had some shoulder surgery, and I know I've mentioned it before, but I had some shoulder surgery before, and the shoulder I was getting worked on, I went to a clinic in Colorado, and when I went there, they said, well, we have lots of people come from out of state, you'll be fine, we'll help you get set up. And I said, great, I would love to go ahead and let's do some sort of travel package or tell me what you have offering. And they gave me a sheet that was literally like this, just, a blank sheet that had been printed out of all the area hotels. And so that didn't really help me. And it was part of the aspect of getting the surgery that was sort of additionally stressful. And so we've tried to eliminate any of that stress, and we've tried to eliminate any of that extra work that may go involved. This is a big decision. And so the last thing that we want is for a patient to be stressed about what, rental car company that they ended up working with or whatnot. And, again, when it comes to the done-in-one experience, when it comes to the patient experience, the number one goal for anybody that we hire, for any process that we instill, for any machinery, equipment, any added package is to connect human to human, make sure that that person is valued and gets a good deal, but is also getting the best quality results that they can, so that they can have some teeth and some functioning good looks for life.
Yeah. I think you said it pretty clear. I mean, I think this whole operation is set up to help people. We want to have relationships with our patients, guide them through this journey. And I don't know anyone else in the industry that really has this quality of an experience at, the, price point that we do. It's fair, it's realistic. And, I would recommend it to anyone that
I
needs
hope
it.
that there isn't anybody else, because if there is, I'd like to know about them and know what we need to add, because we would add it if we could.
Yeah, but things are good in the office, and I think it's an exciting time with the holidays and everything coming up, and hopefully we'll be able to transform some smiles and just in time for the good times ahead.
Yeah, I think the last thing I'll say before we wrap it up is that the whole thing, obviously you've spent years studying teeth and how to do the surgery. I've done the surgery for years, also studied for forever. We care about that side of the results, but at the end of the day, it's not about the teeth, and it's not about how the surgery is going to go, and it's not about how I feel doing surgery or ego side of wearing a white coat and pitching it to a patient and how much I get out of them, etc. It's about treating the people. So it's less about the teeth and it's more about the people. And I hope anyone that's been our patient or will be our patient in the future feels that that's genuinely the number one focus, is that they're seen and looked at and felt, made to be human, on a connection level.
Yeah. At the end of the day, there's so many things that take place before the patient is in our chair. But once you're in the chair, whether it's a surgery or it's for the teeth try-ins, you're the most important person in the whole entire team's life at that moment, and that's what we're dedicated to do. That's our job. We're going to do it as well as we can, and that's our focus.
And when that's the case, it's fun. It's a very fun process and a very fun atmosphere to work in. So, well, with that, we appreciate you guys paying attention and logging in and joining us for this. Like and subscribe, and we'll see you next time.
Yep. Happy holidays to all coming up, and hopefully we'll be on soon.
Absolutely.
Thanks, Dan.
Thanks, Blake.